next speaker دكتورة مريم. تفضلي يا دكتور.
Assalamu alaikum jami'an. Good evening. I'm Dr. Mariam Ameer, Professor of Biomechanics at Cairo University and the Modern University of Technology and Information. First, I would like to thank the head of the General Physical Therapy Conference, Professor Dr. Sami Saad, and the president of conference, Professor Dr. Sami Abdulmoneem, and all the organizing team for inviting me. Inshallah, today I will be presenting a descriptive cross-sectional analytical study under the title of Slouching Shoulder Act as a Hidden Disability among elementary school students that explores one of the most common postural deformities that invades the school student, especially in the primary educational level. First, why the slouching shoulder or uneven shoulder is considered as a hidden disability? Because it invades the muscle, joints, and the whole body mechanics, causing pain, affected the function and participation of the student, especially in the primary educational level. Slouching shoulder has high prevalence, which can affect 81.7% of female and male school students and considered as a major health problem. The slouching shoulder has several causes, such as the poor posture during sitting and standing, the muscle imbalance which affected the muscle that controls the mechanics of the spine and the shoulder, also the spine or leg issues such as the leg length discrepancy or the spinal deformities, injury of the nerve or the nerve damage that affected the muscle that controlled the level of the shoulder. Also the lifestyle habits such as the poor ergonomics at work or carrying a heavy load or uneven load, or the lack of physical activities or imbalanced workout, and many other causes. Actually, the slouching shoulder or an uneven shoulder can cause a visibly higher or lower shoulder, but this sign can be detected in the advanced cases. Also cause the neck, shoulder, and the lower back pain, tightness of the shoulder area, can cause headache, reducing the range of motion and the head tilt or the imbalance between the spine with the pelvis. When the child tries to carry the bag in one side and prevent the slipping of the straps of the bag away from the shoulder by elevating the shoulder in one side, the spine starts to bend sideways, causing muscle imbalance that controls the spine and the pelvis. The heavy bag, more than 10 to 15% of the student body weight, can cause the tilt of the spine and the pelvis for just a few minutes of carrying a heavy load. So what about the students that carry the heavy load for several years? Actually, the slouching shoulder not only cause the physical consequences, but also mental and psychological consequences, because it affected the children confidence and well-being, affected the participation of the student among the community, and affected the student engagement in the social activities. Why we selected in our study the primary school student? Because the addressing of the postural deformities early is very crucial, as the child bones and the tissue are still growing and highly responsive to the treatment. So the detection of the slouching shoulder early is very important to solve the problem from the beginning. So the aim of our study is to detect the risk factors of the slouching shoulder and among the primary school students. So we selected 126 students from Sakaka Al-Jof region in Kingdom of Saudi Arabia, and we detect two age groups. The first group from 6 to 9, and the second from 10 to 12 years. The slouching shoulder was detected using smart AI postural detector software, which has a high validity and reliability in the previous studies. Also, the weight of the school bag was detected using Spring digital scale. All the demographic and the anthropometric data were detected, also the relevant activities, including the methods of the carrying school bag, the attendance of the school physical education session, and the time spent in the extra physical activity outside the school time. Also, the awareness program was provided to the student parents and the faculty staff or the school staff, and the level of the awareness was measured using a survey. Also, the postural education and the exercise program was provided to the student. The key finding of our study indicated that 70.6% of the students experience a slouching shoulder, but the gender was not considered as a risk factor. The risk factors of the slouching shoulder include the methods of the carrying school bag, especially the carrying of the bag in one side, which is considered as most significant risk factor. Also, the lack of extra physical activity beyond the time of the school also contributed to this condition. The older children were more likely to exhibit the slouching shoulder in elementary stage. Also, the heavier school bag weight has a high prevalence of a slouching shoulder. Also, 76.3% of parents and the school staff were willing to learn more about the risk factors and how to modify them to protect their children from the slouching shoulder, and pay attention to this matter after attending the awareness program. So the parents with the school staff and the medical staff assist in the prediction and the prevention of the slouching shoulder, reducing the bad health habits, and boost the children's confidence and well-being, and build the social conscious community. So the key message that I would like to convey in this conference, the application of such important study in the schools of different regions of Egypt also is very important, especially on the elementary school student, to detect the postural problems early by follow the school health policies and teacher training to solve the problem from its origin. Thank you so much for your attendance and attention. Any question?